How do you remove an old implant safely?
You remove an implant safely by, number one, knowing the patient is a good candidate to go to surgery. That we do pay attention to their lab work, past medical history, what medications they're on, etc. So that's a safety issue that comes to any patient that goes to surgery. Safety is paramount. On a list of 1 through 10, 1 through 10 is safety. The rest is 11, 12, 13. Understand safety is paramount. So to remove an implant safely outside of that is usually you go through the same incision where it was placed, particularly if it was placed in the fold. If it's placed in the nipple or the armpit, we go through the fold because that gives you the best access and best control. And when we enter that area to remove that implant, go in slowly, go in carefully, make sure the implant's intact before you extend the incision. And usually it's about a 2-finger breadth incision or about so long. And once you make that incision, then you can retrieve the implant and also any free gel if it's present. If that's the case, it's a bit more complicated. You got to remove the capsule with it, or at least portions of the capsule where you can remove safely. And the rest is bleeding. Make sure there's, you control bleeding and you're careful. You know the anatomy, you have experience. You know where the bleeders are. You stay away from them. Additional to that is really good anesthesia that is keeping the patient under sedation and controlling their circulation, their oxygenation, all those things. So there's a team approach towards safety. I'm a firm believer that when a surgeon goes into his surgery, he's got his team there. People that know the steps, they're experienced, as well as a good anesthesia provider, a really good nurse, and a really good assistant. That's the team usually. And with that, we provide what I consider safe surgery because experience is one of the primary factors in terms of controlling safety. Sucks into that is the team approach, which combines the experience times 4. And that is an experience of 100 years when you add that up plus. So all that comes into play.